So in just a moment, I'm going to hand it over to Grace Rudolph and Michelle Mercure from MDHHS. They are going to talk about alternatives to suspensions, which I'm sure every single building administrator would love to learn about as they continue to deal with issues related to tobacco and vaping. I have a couple of just notes, slides for us before I hand it over to them. Number one, this is a webinar, so although your cameras are off, we still have things like the Q&A system and the chat. Just to make sure we understand which we should be using, we want to use the Q&A to ask questions. So put as many questions in there as you would like. You can actually read what others are posting and hit the like button to upvote those. That'll allow myself to kind of go through and prioritize the questions that we want to make sure we get asked and, more importantly, answered. The chat then will just be for sharing ideas, comments, and thoughts. Okay, so questions in the Q&A, general thoughts, ideas, comments in the chat. We will send out a copy of the slide deck you're about to see and this recording. Usually I'm able to get those out in about 24 hours. So look for that email to come from me, Ryan Casey at MASSP. Probably tomorrow. There will also be some follow-up notes in some upcoming MASSP publications. This is a little disclaimer we have. It's usually more related to some of our legal webinars, but it is important knowing that these are being recorded and you can watch them tomorrow, a week from now, a year from now. Just understand that if you watch these down the road, some of the information may change, right? So it's always important to make sure that the information that you're reading, watching is up to date. So just be mindful of that. And then finally, we've done a ton of webinars this year. And we have our last set coming up here on next Monday and Tuesday, which is our legal survival guide. So some of you might be on here thinking about different policies and practices to help curb vaping and tobacco use in your school. And we know all of the consequences that typically come with that. So the legal survival guide is kind of that updated model student handbook that we use, the principals use to write all your policies in your own school's handbook for the next year. And so we are going to be going through that with Kevin Sutton of Miller Johnson Attorneys, the 27th and 28th from 9 to 11 both days. So it's one event spread across 2 days. And that also gives you access to the latest and greatest legal survival guide, the 2026 version. So you can head over to massp.com/LSG26 and register for that. If you are an executive member with MASSP, this is a free session, and we emailed out a special coupon or discount code to you all to be able to get that for free. Otherwise, it is $200. So if you are an executive member and you haven't seen that email or not sure what to do, shoot me an email and I will get you set up. Other than that, I am going to stop now, and I'm going to turn it over to Michelle. Michelle, Grace, thanks so much for being here. Excited to learn from you both. So I'll let you take it away.
All right. Let me make sure my slides are popping up. That's not the slide I wanted to start with. Let me try that again. Let's try this one. Technology, gotta love it, right? There we go. Are you seeing my slides
looks
now?
good.
Okay,
yep, you're good.
Wonderful. Well, thank you, everybody. Appreciate you being here. I am delighted to be here with you today to talk a little bit about our Vape-Free Schools initiative and looking a little bit more at INDEPTH as an alternative to suspension. And we'll talk a little bit about policy. It was exciting to hear that you have an opportunity to review your policies in depth, because that's really at the core of having successful intervention and cessation programs. So I'm really glad to hear that that's something that you all are addressing. My name is Michelle Mercure. I am the Director of Nationwide Tobacco Programs at the American Lung Association. I've been with the organization for over 25 years. My role has varied a little bit, but in the last several years, I've been focused on our nationwide youth tobacco programs in particular. I am located in Brookfield, Wisconsin, so Midwest and just, across the pond or, just below all of everybody. So, but delighted to be here with my neighbors. So again, appreciate the opportunity. Before I get into the content, I want to just remind everybody and use our disclaimer that any references to tobacco and tobacco products in today's session refer to commercial tobacco and nicotine products and not those of tobacco or other plant mixtures that are grown or harvested and used by American Indians or indigenous people for ceremonial and sacred purposes. This is just a brief overview, and as Ryan said, I'm happy to share a PDF of my slides afterwards. So if you're a note taker like I am, I'll hopefully save you some trouble in providing those to you today. But this is just a brief overview of what we'll be discussing, looking briefly at the data and trends, which I'm sure you are all too familiar with already. We'll talk about a couple of strategies and ways to look at with community partners to become champions for success. We'll talk about the Lung Association's comprehensive approach to addressing youth vaping and other nicotine and tobacco products as a part of our Vape Free Schools initiative. And we will talk about the INDEPTH program as an alternative to suspension option, as well as some additional training and support resources, as well as an opportunity to participate in our communities of practice to support tobacco-free schools and take a deeper dive into that. So let's start with a little bit on some data and trends for you. I am sure you're all too familiar, and I would be curious to know if you all feel that this data is accurate or whether or not you would think it was a little bit higher or lower. Sometimes the perceptions are a little different than what the data actually shows. This is nationwide from the Youth Tobacco Survey. It shows that 1.63 million students are currently using e-cigarettes, and that includes 3.5% of middle school students and 7.8% of high school students. So as you look across you probably are already aware that it is e-cigarettes that are the top used nicotine or tobacco product, followed behind by nicotine pouch use, which I'm sure you're seeing an uptick in that as well. And then also just wanted to share that among those students who are currently using e-cigarettes, 87, so almost 9 out of 10 are using flavored e-cigarettes. So certainly that is a concern. 38% use an e-cigarette on at least 20 of the last 30 days, and 26% use an e-cigarette every day. And those two key numbers are critical because we're really looking at at usage of that rate means that there is a high level of addiction there. So something that we, really want to be able to address and support. This data is the Michigan data from 2023. Grace, correct me if I'm wrong. I'm not sure if we have more recent update. I think that's the latest statistics that we have. But you'll see that the sequence of it, the numbers are pretty much in alignment with what the national numbers are. And then likewise, this slide, you see kind of an uptick and back down. In 2019, we saw the surge of e-cigarette use among youth related primarily to the increased use of Juul. And we're starting to see those numbers decline a little bit, but they're still not down to zero. So there's enough reason to have concern and to be addressing this really from a systems perspective. And that's why it's so important to address it from a policy and looking at how we can support youth using intervention strategies rather than punitive efforts. And then this as well, it's really important just to note that, almost half to a little more than half have indicated that they do want to quit. And so while it's important to have intervention strategies, it's also important to make sure that you have resources to be able to support youth who are ready to quit when they are ready to quit. So again, a little bit more about some of the concerns that we have around vaping and tobacco and nicotine use today and why this is such a concern. We're seeing all of these new and emerging products that are out there that are tech-friendly and trendy. It's not the students, it's not those, your parents' cigarettes or your grandpa's old stogie or cigar. It's something that the youth find appealing and different, and it's more their generation of something that they don't necessarily see the harms, where they may never have considered picking up a cigarette at this point. they're willing to try or experiment, and then unfortunately get hooked on using some of these other devices. We're concerned about the media and the social media influencers and the impact that that has on the social norming of the product, and how it makes it seem as though a lot more students are using it than actually are. We're concerned about the promotion of tobacco-free nicotine products, meaning that they're using either synthetic nicotine or nicotine salts that are not derived from the tobacco leaf. And so that can be really confusing for youth and for adults who misunderstand that these products still can be addictive and still do contain nicotine, even if they are marketed as tobacco-free. We're also concerned about the tobacco and accessory product development and promotion. So all of those little tips and tools and tricks that youth have to be able to conceal their products or to be able to use them really discreetly, which again just makes it a little more concerned to be able to identify students who are using and be able to support them, intervene, and provide some resources for them to be able to quit. We're concerned about the nicotine levels in products, some of them extensively high, looking at some of these vape devices that are the equivalent of, dozens of packs of cigarettes that are available in one device that really can't be measured in the same way that a traditional cigarette can. You can look at the nicotine uptake that takes place from one cigarette versus how much they're taking in. They don't even realize it as they are puffing on a vape, and don't realize until those puffs are no longer there how much nicotine they're actually taking in. And along with that, a concern around students really understanding what nicotine dependence looks like, what it feels like, and really knowing, gosh, this is an addiction and this is something that I'm experiencing and I maybe need some help overcoming. What may start off as just kind of experimental becomes a little more serious. We are, of course, concerned about the mental impact of nicotine, and knowing that youth who are using nicotine are at higher risk for mental health concerns. And also, it's kind of a dual, does the mental health relate to the use of nicotine and the risk of uptake, or is it the nicotine that leads to some of the more, the anxiety or the stress and the depression that's associated with that? We are also concerned about the dual use of cannabis and marijuana alongside with tobacco. And of course, we're also very concerned about the tobacco industry and the influence that it continues to have in reaching and hooking our new generation of students. So lots of different concerns that we have. We have a few different ways that we are addressing those concerns. Hopefully some of these resonate with you and gives you a call to action to take some action to do something in your schools about this. So again, we have some encouraging trends that are happening. We are seeing that the numbers are declining. We are seeing that there are fewer high school e-cigarette users. In fact, this most recent year at the lowest level ever recorded, so that's promising. Cigarette smoking has also hit record lows. So we're excited to see that progress, but we know that it will continue to take some action and continued funding, partnership, and community response to be able to address this, because we're still not down to zero, and any student that is addicted is worthy of providing some support. So let's talk through some of the strategies. You all are, I'm sure, very familiar with some of the data out there that indicates, we know students are in school to learn. If they are suspended and they are removed from the classroom, they are losing out on that learning opportunity. Nationwide, school children have lost over 11 million days of instruction as a result of out-of-school suspension. Now, that's not all, that data is not specific to tobacco use, but looking at the number of hours missed, you can certainly understand as administrators the concern about having students not be where they are intended to be, and knowing that a lot of times when students are suspended, they're going home and doing the things that they got caught doing in the first place. So is that really the way that we should be approaching it? And I would encourage you to kind of think of other ways to be able to address this. Okay, suddenly my slide is not advancing. There we go. There we go. Sorry about that. So also wanted to share, if you are not familiar with, the Public Health Law Center has an excellent resource. We know that research shows, as I said, penalties like expulsion and suspension do contribute to consequences, educational and life outcomes, undermining the students' opportunities for learning. We really should be looking at tobacco use or nicotine use and addressing it as an addiction rather than a behavior issue. So this resource is a great overview of ways to look at alternative measures and justification for why it's important to consider that over punitive efforts. So if you have some staff or other administrators that are resistant to considering intervention versus a disciplinary approach, this is a great resource to share with them as kind of a neutral party to address intervention. So why use a supportive approach? We talked about before, the student well-being and mental health are so connected with vaping and tobacco use. So that alone in addressing the mental health of our students is important. We know that many students who are using nicotine report feelings of sadness or are potentially seriously considering suicide. So they are, that connection with vaping or nicotine use and mental health is concerning. Most students do want to quit, and that the data showed that over 50% of the students do want to quit. So it's important for us to address this from an intervention perspective, a way to support and help students rather than just punishing them, which doesn't really address the behavioral aspect of it. We know that schools are on the front line of the vaping crisis and are uniquely positioned to support students who do want to quit. You're at the front lines. You are seeing this day in and day out. But it doesn't have to fall on the school necessarily. There are opportunities to connect with community partners to support and offer these programs. So, by using an approach that uses intervention strategies as opposed to punitive efforts, there's a way to really support that behavior and that behavior change and lead them and encourage them in the direction of helping them to start their quit journey when they're ready. So it's really important also not only to have those intervention strategies, but to ensure that you have cessation resources that are available so that when students are ready to quit, they know where to go and can be successful in using those resources. I don't know why. My slide is not okay. I guess I have to click on the slide. It's not cooperating. I'm sorry about that. So we know that in addressing this as a school, we encourage you to really kind of take a step back. And like I said, I'm excited to see that you're addressing the policy perspective of it, because really changing this approach from a punitive approach to a more supportive aspect, it takes some time. It doesn't happen overnight, and not all schools are ready to do that or able to do that. So really working as a district or working as a school building, working within your community, and really kind of building that foundation will lead to the most successful implementation. So looking at your policy and ensuring that it is comprehensive, that the language is there and supportive, kind of across the continuum from prevention to intervention and cessation, from our youth, our students, to our faculty, to our school visitors, ensuring that, you know, your school campus and your district is covered 24 hours a day, 7 days a week, 365 days a year. So all of that is important to address, and really ensuring that your policy is clearly communicated and that it's, you know, enforced in a way that allows for a supportive process versus a punitive approach. As I mentioned before, it doesn't fall solely on the schools necessarily. Consider working with your community partners, working with healthcare providers, working with other resources to be able to refer students to intervention or for education or for cessation resources. It doesn't have to fall just on the school, but knowing where those resources are and how they're available is also important. So these are some questions that I would pose to you to give some thought to as you are engaging in this process. So think about who your champions are and who you will engage. So as administrators, excuse me, you have a firsthand effort in addressing the policy piece of it. But who are the folks in your school that also can support you with this? You know, we often think of it's the guidance counselor or it's the school nurse when we're addressing something like nicotine addiction. But there can be other folks that can be champions and can help support with referrals, with supporting students as they're going through the process. So think about those people that are the change makers or the difference makers. They can be the folks that are implementers or facilitators for the program. They can be key people who would make referrals into some of the programs or can offer support and cessation. Think about those champions that are community partners. Think about healthcare providers or health departments or even the judicial system. All of those can be great partners that can help support your efforts for this. When you're thinking about what you should be discussing, look at not only the policy language, but consider what the referral process is. And if a student is referred to an intervention program, what does that successful implementation or successful completion of that program look like? Do they need to complete it within a certain time period? What is the desired outcome of their participation in the program? Another thing to discuss is what are the quick resources that are available. Again, that doesn't have to fall at the school district level. It certainly could fall with treatment facilities, with community partners, with healthcare providers that can help students quit when they're ready. Think about where you can offer the program. It can be in the school building. It could be within the school district. It could be within a community partner, or again, in a healthcare setting. So lots of different aspects and things to consider as you're implementing. And then thinking about the when and the how. Well, we'll address an example of our intervention program called INDEPTH, but the logistics of that, if you are offering it within your school, when will it be offered? Where will it be offered? Will it be offered on a rotating basis? It is a 4-session program, or there's an option to offer the program online that can be done as an immediate referral. So thinking about that when and how does that all work? Those are all things to take into consideration. And then lastly, why? We're looking at really understanding that it's about the education and awareness, that we're looking at using an intervention strategy that really helps the student to understand nicotine dependence and recognize that, to help them understand the opportunity of living a tobacco-free or vape-free lifestyle, and offers the opportunity for skill building, for stress management, for communication skills, some of those other pieces that, while they may not be directly connected with the use of tobacco, giving them those skills and building their resilience can help them in the long run in other aspects outside of just their tobacco use. Of course, we always want to be mindful and talk about some of the challenges that may come up. So another thing to discuss is looking at what happens if you have repeat offenders. So is there a process for first offense and then for a second violation or a third infraction? What are the subsequent violations? What happens with each of those? And talking through what does that look like in your particular school. Also looking at the use of THC in cannabis. We know we're seeing increasing numbers, especially of dual use of tobacco with THC in cannabis. So how is that handled? What do the referrals look like for treatment for that, for support for that? Really taking a deeper dive and addressing that. Looking at, does your school or district have a history or an institutional use of punitive efforts? And switching that over to more of an intervention strategy, again, takes time and takes some effort. So what does that transition look like? And if it's something that is systemic, is there a different way of approaching it using more of an intervention and a supportive strategy versus punitive? Think about use of vape detectors. Some people feel that that's an opportunity to catch the students. Oftentimes it results in the punishment of students. So it's not our preferred method, but we know many schools that are well-intended, looking at having a line item that they can, purchase and show that they are taking steps to address this. Often will install vape detectors. So I'd be curious if you want to put in the chat if anybody has had some experience around for positive or for negative, what your experience has been with vape detectors. Anticipate challenges from parents. You may get some parents who are very supportive of addressing the nicotine use or tobacco use with their students, but you may get some parents who are resilient because perhaps they are tobacco users themselves. So being prepared for that and being prepared to have some resources and information available for them is also important. We are unfortunately seeing an increase in the number of violations for students in elementary schools too. So what is happening with those younger kiddos and how are we addressing that? Taking more of an approach of educating parents and looking at, access to those tobacco products, looking at, more within a community, how are those students even able to obtain some of those products? So those are all some things that you can just address and discuss and take into consideration as you're looking at your policies and looking at intervention strategies. So this is just the American Lung Association's stance, if you will, on vape detectors. We feel that placement of vape detectors often results in punitive measures, and oftentimes it lacks the educational pieces or that intervention strategy. So we really encourage schools, instead of using vape detectors, we know that vape detectors can't protect all the students throughout the entire school. For those that have installed them, oftentimes students who are not tobacco users are concerned about using those restrooms or using where or going places where those vape detectors are placed. So that can cause harm. And, looking at the data, the majority of students are not using these products. So punishing those students that, aren't using them isn't helpful or beneficial either. So really looking at whether or not this is an effective strategy. I know some people have put some, tremendous amount of resources into them. We really encourage schools to use implementation of alternative to suspension programs and education programs. So I'll spend the next couple of minutes talking about some of those programs as part of our Vape-Free Schools initiative. So this slide looks a little busy, but really takes a great kind of logic model, if you will, or kind of a stance on how we address at the American Lung Association our comprehensive approach to addressing youth vaping tobacco and nicotine product use. So kind of starting at the base of youth engagement, we really encourage students to be a voice that can be heard. We have several states that we work and support our youth empowerment programs, but students can be involved regardless of whether or not there's a state sanctioned program. But moving on up the chain, we want those students, that's that yellow arrow going up through the center of it. We want students to be the voice and be active and be a participant in all aspects of these tobacco resources and initiatives. So looking at that pyramid, kind of starting from the bottom, the Lung Association offers our youth empowerment webpage that has some great resources for students who either from a prevention perspective, want to be engaged and participate in youth activities. And this is across the board, not only for tobacco control, but can be involved in, other health issues as well. So a great resource there. Going up the next level is our education component. And for that, the American Lung Association offers our Ask Counsel Treat, our ACT to address youth cessation training. So this program is based on the American Academy of Pediatrics clinical considerations for tobacco cessation. AAP's clinical considerations really addresses that from a clinical perspective. So looking at what takes place in a clinical practice. We've expanded that information, the intervention strategies and the resources to be used by school staff, so counselors, nurses, social workers, coaches, teachers, everybody that is working with students to really, how can you look at intervening using this Ask, Counsel, Treat method? So we talk about that evidence-based strategy and cessation resources and how anyone can support youth who are using nicotine or tobacco products. It's a free training. It's available on demand. It takes about an hour to complete and has a variety of different downloadable resources. And the QR code that you see there will take you directly there if you happen to have your phone handy. Also, as part of our educational resources, you'll see that the American Lung Association offers a breadth of different resources, both in English and in Spanish, a variety of different, promotional resources for some of the programs that we're going to be talking about, but also resources for school staff and for parents, some, one-pagers and some overviews of different resources that are available. So there's too many to go into, but a lot there for you to explore. Many of these, if not all of these, really are found on the American Lung Association's webpage at lung.org. Our next tier up is our policy change, and that really is looking at your policy from a core level. So we offer this policy assessment to encourage you to go through your school policy and identify where there are strengths, but also where are there gaps that you could address. We don't collect the data from this. It really is a tool for you to look at, gosh, we didn't realize that we were excluding, we weren't really addressing tobacco use by staff, or we really haven't been effective at enforcement with parents on, our sporting fields or in our, in the parking lot. Are there areas of your school that are not covered? Are there places that you're maybe not communicating your policy? So it just gives you an opportunity to review your policy and see where you could perhaps make some corrections. And then we do, and I know Michigan has some great guidance for standardized language for tobacco-free school policy as well. The Lung Association offers some template policy language also, so some resources available for you there. Then our next tier up focuses on prevention, and this area, we're really looking more at addressing prevention from a parent perspective. So if you're looking for resources that you can share with parents around nicotine and tobacco product use. We have a program called Talk to Your Child About Vaping. It is an online, again, free resource. It takes about 1 hour to complete this, this course. It is addressed to parents, guardians, caregivers to talk to your student if you suspect that they might be using. There's kind of one path that you can take. Or if you are just concerned and really want to understand more about, how can I focus more on resiliency skills and prevent my child from using, there's a second approach that you can take. Within this training module, there is some gamification. So parents get the opportunity to, look at a mock-up of a bedroom and look at where students might be hiding their vaping devices or their nicotine products, and some recommended actions to take for if they have found that a student is using. How can they have a conversation with them about, rather than accusing them, but offering a supportive and restorative approach to addressing their use, and then again seeking resources and helping them to quit when they are ready. The other aspect of this tier is a campaign around that we've worked with the Ad Council for the last couple of years, Talk About Vaping, which really is a prevention communication guide for parents that encourages parents as the key person who can talk to their student and prevent them from beginning to use it to start with. So a couple of different resources that are available through that as far as support for parents. So encourage you to take a look at that. All right, our final two tiers really address some components that you as a school or school district can utilize. So we'll start with our intervention and then wrap up with our cessation resources. So the INDEPTH program is our alternative to suspension program. It is the longer name for it is Intervention for Nicotine Dependence, Education, Prevention, Tobacco, and Health. It is our alternative to suspension program, intended to be offered as an educational and restorative practice approach versus a punitive approach. The program is facilitated in 4 50-minute sessions, and it addresses several aspects of it, of looking at the harms of tobacco, looking at nicotine dependence, establishing healthier alternatives and healthier lifestyles, and taking the steps to be able to address nicotine use. So taking the steps to lead towards cessation. What we found for students who have participated in the program is that at least 60% of the students who go through the INDEPTH program indicate that they are willing to quit their use of tobacco products as a result of their participation. And so part of that is the importance of making sure if they are ready to quit, making sure that they have resources to help them quit. We have 2 different modalities of this program. We have an in-person facilitated program that can be done either individually or in a group setting. Again, 4 sessions, about 50 minutes each, which equals about 4 hours of instruction time. It is facilitated by a trained adult. It can be done virtually or in person. It can be offered as often as needed. It can be offered in, different types of sequences. So it can be offered in 1 session, it can be offered in 2 sessions, or it could be offered, in 4 separate times. And then on the other side of that, we have our INDEPTH Online. We do recognize that many schools have limited capacity for implementation of programs. And if you're thinking offering an INDEPTH program multiple times a month or multiple times a year, I had one facilitator in northern Wisconsin talk about how she she was the school social worker. In the spring, she had 94 referrals for alternative to suspension. So being able to provide resources for all 94 of those students in a smaller district, she was like, I'm not sure how we are going to address this. So she was thrilled when we expanded to include the INDEPTH Online program so that she could refer students into it The in-depth online program is more of a self-guided. The students are referred into the program. There are 4 modules. It's very similar content-wise as far as the in-depth program is concerned, but the students go through it at their own pace, and there's the opportunity for a facilitator or for somebody to work with the student and kind of support them as they go through the process. So it's not fully self-led, but it does offer the opportunity for a student to participate as soon as they are, in violation of the school policy, rather than waiting until the next in-depth in-person program is available. Both of these programs have knowledge checks and evaluation that are integrated into them, and both of them have a student certificate of completion that is available at the end of the program. So if somebody is facilitating the program or if the student participates online, there is, the proof of performance that they have completed it. And there are those evaluation components to ensure that the students are completing the content and processing the content as needed. So nationwide, since the in-depth program launched, we've had actually now the number is close to 6,000 in-depth facilitators that have been trained. In Michigan, that number looks more like 328 facilitators who have been trained in the last 5+ years. And in this year alone, we've had 63 that have been trained in the program. And in-depth online, we have had, in Michigan, we've had 52 sites that have applied to offer the program online. So excited to see those numbers grow. And then I'll say kind of last but not least, let's focus a little bit on cessation as well. The American Lung Association, as a part of our Vape-Free Schools initiative, also offers the Not on Tobacco or NOT cessation program, which is an evidence-based program that has been around for over 25 years. It takes a holistic approach using a behavior change model. The program is offered by a facilitator who's trained at Lung.Training, which is about a 5 to 6 hour training. So it's a little more intensive, but it is a behavior change and really addresses the core of the nicotine dependence and nicotine addiction. The program is offered in 10 sessions, about 50 minutes each. So it takes about a semester to implement this program. It's conducted in small groups. But we also have a separate modality for this as well, for students to participate independently and online. I also would just mention that, again, the school does not have to be the people that are offering this program. You can work with community partners to be able to incorporate this or offer this program separately. Treatment facilities, health departments, healthcare systems are all options for you to partner with to be able to offer cessation resources like this. So this is just a side-by-side comparison of the two modalities. Similar content again, but not intended to be offered concurrently. Because the content varies slightly. But there are, pros and cons to each. There is a little more infrastructure and support and accountability within the in-person program, but again, from a staffing capacity to be able to refer students into the program for an online version may be more helpful with limited capacity. So the Not For Me program, diving in a little deeper on that, is a web-based program. Again, it's very similar content-wise. It takes, both programs really take a holistic approach in looking at healthy lifestyle, looking at stress management, looking at nutrition, fitness, and communication skills, all as part of building that resilience. So it's not only addressing their nicotine or tobacco use, it's addressing kind of lifestyle changes that they can make. So I wanted to include this because we have some schools that come to us to say, I really need to address this vaping or tobacco use in my school, and I'm not sure where to start. When we look at the stages of change, we recognize that when behavior change takes place, it doesn't happen overnight. And we always say, you know, it's the old adage, you can lead a horse to water, but you can't make it drink. Maybe part of that is trying to make that horse thirsty, right? So looking at the phases that students may be in, they could be, you know, not even thinking about quitting or not even recognizing that they are even addicted. So they're kind of at that pre-contemplation, contemplation, preparation phase. That's really the appropriate, you know, arena or area for in-depth. And then when you're looking at students who are ready to take action, they're ready to quit, the not or not on tobacco is the more appropriate program for them to be involved and engaged in at that point. So really understanding what the best placement and best option for resources is an important piece. So just wanted to wrap up with a few additional training materials. Our lung.net training programs are available 24/7. So our programs are available online. So you don't have to attend a out of school session. You can do it at your own pace. They don't have to be completed in one setting. You log in and then can complete them, you know, as you go. It remembers your progress. Facilitators do receive a certificate of completion for each of those programs. So if you need that for continuing education hours, that's available. All of the materials for the programs are available as downloadable files, so you have immediate access to those. So the programs, some of those I have already mentioned. We have INDEPTH, we have not, our Vape Free Schools initiative, our Act to Address Youth Cessation, we have Tobacco Basics, Advocacy Basics, and a number of other lung health related resources. Most of them are available free of charge. The only one that there's a cost is the NOT program, and that's a $400 registration fee for that. And thank you to the Department of Health and Human Services. We do have a limited number of scholarships available. So if you have somebody who is interested in getting trained in that, please reach out to Grace or myself, and we will point you in the right direction for that. Again, just want to share some additional resources. We do recognize those emerging trends. So looking at, you know, nicotine pouches, looking at, you know, cannabis and marijuana and other resources. We do provide some support and materials for those. So this is just highlighting that educational resources and our marijuana and cannabis resources that can help in addressing that as a concern as well. And then before we close out, I wanted to share with you an opportunity to participate in our Michigan communities of practice. So these groups are small group collaboratives that are facilitated over the course of several sessions that offer peer support, will identify best practices, really will take a deeper dive into the conversation points that we have gone through earlier in today's presentation. We'll share resources and address facilitation strategies, really looking at policy, looking at overcoming challenges, and we'll celebrate successes as well. And it also offers us the opportunity to provide technical assistance when you need that additional support, both from a peer support level, but also from the Lung Association or MDHHS. So these are the topics that we cover are looking at the comprehensive tobacco-free policy, addressing restorative versus punitive practices, again, identifying champions and looking closer at who those might be, additional resources that are available, and talk about training opportunities for in-depth and not. So all different types of implementation practices and more. These are the upcoming dates for those. So we have some spring sessions taking place as well as fall sessions. So I know for some of you, end of year is a very difficult time to do it. Although this time of year is actually an ideal time to do it because it gives you the opportunity to address this in the upcoming year. But we are also offering a session in the fall. So in participation, we ask that students have, or that the school, have representation at all of the sessions. We are looking for a team approach, and as a part of that, must have administration participation. and involvement. And we encourage school and community partnerships to be involved. We do have limited space. We have a couple of spots still open. So if you're interested, certainly let me know. We are prioritizing those areas that have high impact, high need. And from this participation, you will be able to utilize the tools immediately within your school. So if you are interested in participating, these are this is the survey to kind of, doesn't register you per se, but it does give you the opportunity to sign up and let us know which sessions you might be available or interested in, or to put your name on the list for future opportunities to participate as well. And so I'll leave that up for just a moment. This hyperlink here, or this QR code here, takes you to our comprehensive approach, which has all of the links to all of the resources that I shared earlier. But I will also send out the PDF of the slides as well. So Ryan can get that out to you later today or tomorrow. So with that, I will open it up for any questions. I think we have a few minutes still.
Yeah. Thanks, Michelle. A bunch of questions came to mind as you were kind of wrapping up the last handful of slides. And so I'm curious, just in actual practice, for those who are choosing to use the in-depth program, I'm curious, how are they actually implementing? So when there's a student that gets caught vaping, right, or they're caught with a vape on them, is it can you just walk us through like what some of the best practices are and what that actually looks like? I'm imagining
Sure.
some are saying, well, it's a restorative opportunity, right? We can say, oh, you're going to be suspended unless you complete this training starting in the in-school suspension room, right? Or
Right.
we send you home and it's going to be for 5 days. But the minute you complete this module, you can return. Or I'm just curious, like, what are you seeing or hearing in terms of the most effective approach?
Yeah, so that's a great question. And really, what we have found is it's customizable so that the school can do what works best for them, right? So if you have an in-school suspension opportunity where students are held in an in-school suspension room, it's the perfect place for either offering an in-depth program if you have a facilitator available, or saying, while you are sitting in this room, you need to complete the in-depth online program. And students who are referred into the online program, they're sent an email and they can log in and start the program immediately. So it's about 2 to 3 hours for them to complete it. It also offers the opportunity for that person in the in-school suspension room to talk to the student partway through, or see, do you have any questions? I see that you're, in session 2. What did you learn from that session? So there's a discussion guide that's available, and you can interact with students that way. We have some schools who offer the in-depth online program as the first offense. So if a student is caught, that's the first trial. And some schools will do it again as an in-school opportunity. Some will do it saying, instead of after school detention, or they are required to complete the program and provide their certificate of completion within 2 weeks. And if they do that to the school's satisfaction, then they've met the criteria for doing that. Then we have some schools that, as a more intensive intervention, offer in-depth as a group session, or even as a one-on-one individual, although again, bandwidth for that can be a little more challenging. So really, that's where coordination of offering the program, it's identifying who the facilitator is. If you're offering it as a group program, identifying what the logistics are, what that schedule looks like. Is it I know I'm dating myself by saying this, but is it like a breakfast club, Saturday, kind of a diversion program that they have to attend outside of school? And that can be offered maybe in just one sitting, or it can be offered weekly for an hour each week, or it can be offered twice. So again, you have the flexibility for how it can be implemented. It really is up to the school to determine what's going to work best and what they have the capacity and bandwidth to be able to do.
Perfect. I know Grace looks like, or at least she was typing, or she did respond. I think it looks like Grace. I know somebody had a question about the actual, like we might implement these alternative approaches to dealing with the suspensions, although it sounds like some people have been told from their, county courts and prosecutors that they still want them turned in, especially if it's maybe cannabis versus tobacco. So, Grace, were you able to answer that for Dolly or no?
Yeah, I was typing it in, and I'm so sorry I have allergies, but was typing it in, and I got a little button happy, and I pushed enter, and it answered, and it said thank you. That was it. So I'm sorry about that, Dolly. So I'll just come off of mute and just kind of go over it because it is a great question, and we do have that concern come up quite a bit. So as an alternative to suspension program, if you put it in your school or district's policy, that is the first step. From my understanding, and I will get clarification because there are differences between state and city ordinances and districts. So there is kind of this convoluted, very messy way of going about it. Your prosecutor is correct. Technically, it is a minor in possession. But if in your school policy you put alternative to suspension and other approaches that are non-punitive driven, you do not technically need to report. And I say that, and I know this is being recorded, so you are supposed to report. On all terms, it is what you are supposed to do, but you can write your policy to be more supportive of youth in a non-punitive approach. The other thing that we're learning is a lot of SROs and juvenile probation officers do not have the resources to support youth. So once they get a minor in possession, then they have to go through the probation, they get a citation. It can be a very devastating uh, consequence to a very severe addiction. And I think a lot of people and Michelle, I'm going to date myself right on there with you. But when I was going through school, tobacco is just tobacco. It's not a big deal. It's not really a substance. It's not really a danger, but it truly is a gateway drug. High concentrations of nicotine found in vapes and in pouches is very addictive. And we're still learning those adverse effects that is having. But one thing I'd like to say when we talk about addiction to nicotine, there are articles, there are studies, and if you need proof, I can share it with you, but it is stated to be as addictive as heroin and cocaine. So now you're talking about a substance that has a very low perceived harm, and it's just as addictive as some of the more harder recreational drugs. I hear very sad stories of youth using e-cigarettes and then swapping to cannabis or THC at high concentrations. That is no longer working, and so we start to see dual use, and then we progress into dual recreational harder drugs that are really affecting youth. So my sustainable way of saying this is that relooking at your school policy, just like Michelle said, relook at your school policy. How can you be supportive? How can you support youth? Right now at a national level, we have a group of hardworking youth coordinators across the nation who are working together to build a toolkit for SROs and juvenile probation officers that will be editable per state policies. So it is a pretty comprehensive approach, and it's going to take a little while to get that out because everybody's just a little bit different. Some states do not have SROs, and so really understanding what that approach is and how we can build relationship between law enforcement and youth that are addicted. How can we build a more sustainable strategy to support youth through the addiction process instead of penalizing them and then just keep pushing them through the same process of suspension, expulsion? We are learning more and more that there are schools out there, even in the state of Michigan, that after the second time being caught, they are removed from the school. They cannot come back to the school. So now you're seeing the adverse effects of education impacted by what we perceive as a non-harmful addiction. So sorry, I know I went a little over there, but it's a pretty in-depth question, and I appreciate the question, Dolly.
Thanks, Grace. It is 10:02, so we got to get people out of here. I appreciate the time. Final question for you, Michelle. I know as an administrator, I would not want to assign something to a student to complete or a staff in my building to complete without seeing it, at least part of it myself, whether I'm going to complete the course. But is there a way, like, so if somebody wants to bring this to their school, that they can see a sample, there's a sandbox, they can be a demo learner, something like that, so they can just understand like what it is and the quality of the product? Is there a way to do that?
Yes, we can set them up as a demonstration school, so they can go in and take a look, play around a little bit, look at what the evaluation questions are, look at. There also is a dashboard. I didn't go too much into this, but there's a dashboard for facilitators to kind of monitor student progress, so they can see how far along they are. They can actually see some of the answers to the students' questions that they have. So there's an opportunity for engagement. So it isn't just a hands-off, refer them in and let them do it on their own. You can actually, kind of check in and see how they're doing and interact with them. But yes, we can get demonstration components to folks as well.
Excellent. Well, thank you again, Grace and Michelle, for sharing that with us. Everyone else, enjoy the rest of your day and week. Be on that lookout for the email with the slide deck and the video recap from our time together. Thanks, everyone. Take care.
Thank you, everybody. Have a great day.